Welcome to Raaonline. So today we have a very interesting topic, the Legionella. Okay. So when we are discussing about meningitis, usually they will ask you about a listeria. Don't get confused between the listeria and Legionella. Both are different group of bacteria, different gram strain. They affect different set of organ systems, and the immunity basis also is totally different. So it's better to know about Legionella as well. Okay. Legionellosis refers to the two clinical syndromes caused by the bacteria of genus Legionella. One is a simple Pontiac fever. It's basically a acute febrile self-limiting illness. Okay, we are not much worried about this Pontiac fever. The second is the Legionnaires Disease. It's a severe form of pneumonia caused by Legionellosis. Okay. So, discovery of the new bacteria. This Legionnaires disease was first recognized in 1976 when there was an outbreak of pneumonia at a hotel in Philadelphia during an American Legion convention. Okay, and the causative agent was diagnosed as Legionella pneumophila, basically a newly discovered bacterium. Okay, and this was actually isolated from the lung specimens at the autopsy. Okay. So coming to the microbiological aspects, this belongs to the family Legionellaceae, which comprises nearly more than 49 species and 64 serogroups. Okay, and in particular, the species Legionella pneumophilia causes 80 to 90% of human infections, and it alone includes around 16 serotypes. Among the 16 serotypes, serotype 1, 4, 6 are most commonly implicated in human infections. Okay, so to date, 18 species other than the pneumophilia are associated with this kind of human infections. It can be Legionella mygdadi or Legionella bosemanni or Legionella dumophyi or Legionella longbeckae. All these things are associated. Okay, but the most common, around 90%, is going to be your pneumophilia, serotypes 1, 4 and 6. So Legionella is basically aerobic gram-negative bacilli that do not grow on a routine microbiological media. Okay, so it requires a special medium, that is a buffered charcoal yeast extract. Okay, it's called BCYE medium, which is used to grow the Legionella. Antibiotics were added to the medium to suppress the growth of competing flora from non-sterile sites, and dyes were used to color the colonies and assist in the identification. Right. So whenever you enter your hospital, you might see there will be big water bodies, basically the air filters or air humidifiers for your air conditioning, right? There will be huge water bodies kept there, right? Air filters, okay? And it was said that Legionella usually spreads through this kind of water bodies, right? But later, actually, it was disproved that it was not that big water bodies which is the primary cause of Legionella. There are other secondary causes as well, okay? Let's see to it. So direct fluorescent antibody test can identify several individual serotypes, several individual species as well. Okay, in case of Legionella pneumophilia, the serogroup specific antigen and antibodies detected by immunofluorescence are directed against the lipopolysaccharide. That's a prominent outer membrane component. Okay, so it can actually diagnose which serotype as well, whether serotype 1, 4 or 6, or which particular species, whether it's pneumophilic or it's the other species of Legionella as well. Okay, so both polyclonal and monoclonal DFA reagents are commercially available. Okay, the monoclonal reagent is less cross-reactive and it's also specific for pneumophilia. So you can exactly tell which serotype is causing this infection. Okay. So coming to the ecology and transmission, the natural habits for Legionella pneumophilia are aquatic bodies, including the lakes and streams and freshwater rivers. Okay, sometimes, very rarely, there are other species like Legionella longbeckae, which has been isolated from soil as well, and this can also cause human infections. But 90% is going to be pneumophilia only. Okay, Legionella can survive under a wide range of environmental conditions. That is, it can live for years in refrigerated water supplies. Natural bodies of water containing only a small number of Legionella, understand, whatever lakes, rivers which I told you, do have Legionella, but they have in a very, very small quantity. However, when you take that water and you store it for human constructed aquatic reservoirs, then they can grow and multiply and proliferate in that particular water body. Okay. So factors known to enhance the colonization amplification of Legionella include warm temperatures, that is 25 to 42 degrees Celsius, stagnation and sedimentation. So it is actually difficult to eradicate this pneumophilia from this kind of water reservoirs in your hospital or some commercial areas, because usually this kind of water reservoirs will have some amount of biofilms, right? So this Legionella pneumophilia has a capacity to form microcolonies within the biofilms, right? So for its eradication from such water distribution systems requires disinfectants that can penetrate this biofilm. Moreover, behind this biofilms, there are presence of symbiotic microorganisms which help this particular bug, the Legionella pneumophilia, to grow better. So this kind of symbiotic relationship exists between the algae, amoeba, ciliated protozoa and other water dwelling bacteria. All these things promote the growth of Legionella pneumophilia. Okay. So thus Legionella can invade and multiply within free living protozoas as well. So now we are clear that the source of Legionella is water, less likely a river, less likely a stream of water, but more likely a stagnated water, okay, possibly in a reservoir. And community acquired Legionnaires disease is linked to colonization of a residential and industrial water supply water reservoirs as well. Okay, but recent studies say that it is not only this kind of water bodies which is used for other purposes in your domestic and industrial area. Okay, so water is used for many reasons in the industrial area, right? Even a residential area for vessel washing, for bathing, we have a lot of reasons we use water. But compared to those kind of water demands, the potable water, the drinking water supply in hospitals and other institutions was identified as the top and leading cause of Legionella spread. Okay, such portable water distribution system contained more amount of Legionella, and that was the reason for Legionella disease in the patients. Okay, not your regular residential industrial water supplies. Okay, cooling towers and evaporative condensers have been overestimated as sources of Legionella. When Legionella was actually discovered, it was said that it is only because of the cooling towers, it's only because of the evaporative condensers, it's because of your air conditioners which you use in your room. The Legionella is being spread from the AC reservoirs, from the cooling towers, through the air conditioner, inside the room, and these people get Legionella. That was the initial thought process, but actually that was an overestimation. Okay, it is actually the drinking water, the potable water system, which is actually the culprit. So it is now known that in many outbreaks attributed to the cooling towers, the cases of Legionnaires disease continues to occur despite disinfection of the cooling towers. Okay, so moreover, whenever you attribute certain area or certain disease to a particular bacteria, or you attribute certain causative agent to be influencing a disease, then that has to satisfy the Koch postulates, right? But the Koch postulates have never been fulfilled for cooling tower associated outbreaks, as they have been seen for hospital acquired Legionnaires diseases. Okay, so it is a portable water supply was the actual source. So mode of transmission, multiple modes exist for Legionella to get transmitted to the humans, including the aerosolization, aspiration, direct inhalation to the lungs during respiratory tract manipulations. Okay, so now we know that it is the water which is contaminated with Legionella, that's the main source. It's a potable water which is the leading cause, and next comes with the cooling towers and stuff. Okay, and among that, they have multiple mode of transmissions, and among that, aspiration is now known to be the predominant mode of transmission. Okay, but having said about aspiration, we really don't know whether the Legionella which is present in the oropharyngeal area, that is getting aspirated, or I drink a water contaminated with Legionella, the water goes into my stomach and then I regurgitate, okay, and that it goes to the lungs. So I really don't know whether it is the oropharyngeal colonization which is reason for the aspiration of Legionella, or drinking of contaminated water which is by regurgitation getting into the lungs, right? So nasogastric tubes has been linked to hospital acquired Legionella disease, because microaspiration of contaminated water was the hypothesis mode of transmission, and whoever has a Ryle's tube or the nasogastric tube, they have more chances of this kind of regurgitation and aspiration. Moreover, whatever the risk of aspiration is, so those patients had more chances of developing a Legionella disease. Okay, surgery with general anesthesia is a known risk factor for aspiration. right? Especially is the compelling is the reported 30% incidence of post-operative Legionella pneumonia among patients undergoing head and neck surgery at a hospital with a contaminated water supply, right? So head and neck surgery, there is a surgery and head and neck, it is in the head and neck area, and the patient had access to the contaminated water supply, so they developed Legionella pneumonia, reported incidence 30%, okay, because all these things is related to aspiration sequelae, right? So whenever you do a surgery, that too in the head and neck area, aspiration is on the higher chance rather than doing a surgery in somewhere else in the body, right? So this tells us that aspiration is the main reason. So studies of patients with hospital occurred Legionnaires disease have shown that those individuals underwent endotracheal intubation significantly more often for longer duration compared to other patients who had hospital occurred pneumonia. Okay, so again, endotracheal intubation. Okay, so that is also a more common cause. Aerosolization of Legionella by devices filled with tap water, including your whirlpools, which is used for many reasons outside India, doctors. Okay, so inside India we use less of this kind of whirlpool type of techniques for many reasons, but in abroad they are using very often for many indications. Okay, so tap waters, whirlpools, nebulizers, humidifiers, all these things, if the water which you use in this kind of situation, if it is contaminated with Legionella, still the patient can have a Legionella disease. Okay, an ultrasonic mist machine in a grocery store was a source of a community outbreak. Okay, such serious is the issue. Okay, even in our hospital, usually we'll be finding this kind of ultrasonic mist machine, right? If that particular fluid, if that particular water is contaminated with Legionella, even that can spread Legionella disease. Okay. Coming to the epidemiology, the incidence of Legionella disease depends upon the degree of contamination of the aquatic reservoir, immune status of the person exposed to such water, of the intensity of the exposure, and availability of the specialist lab test to first identify and document and diagnose the disease. Okay, numerous prospective studies have ranked Legionella among the top 4 microbiological causes of community-acquired pneumonia. So in your exam, if they ask about community-acquired pneumonia, among the top 4 causes you still have Legionella, and you need to present the case as well. So first is definitely Streptococcus pneumoniae, second is Haemophilus influenza, and third is Chlamydia pneumophilia, which rank the first, second, and third, and the fourth is going to be a Legionella. So on the basis of multi-hospital study of community-acquired pneumonia in Ohio, the Center of Disease Control and Prevention estimated that as many as 18,000 cases of sporadic community-acquired Legionnaires disease occur annually in US. Among this 18,000 cases, only 3% are being correctly diagnosed. Okay, so look at the difference about the incidence and the diagnosis difference. So Legionella is responsible for around 50% of cases of nosocomial hospital-induced pneumonia when the hospital water system is colonized with organisms. Okay, so the incidence of hospital-acquired disease depends upon the degree of contamination of the water system. Okay, so whenever we speak about degree of contamination of the water system, we usually check the water present inside the reservoir, right? But here, in terms of Legionnaires disease, it is not that you need to check the content in the reservoir, because even the channels can have biofilms, even the pipelines can have biofilms, which can be missed if at all you are checking only the reservoir, right? So the degree of contamination of water reservoir system is defined as the rate of positivity of distal water sites. Okay, it's not as defined qualitative by the number of colony forming units per liter, but at the rate of positivity of distal water sites. For example, you have from the reservoir, it goes to around 100 tap waters, right? So you're checking all the 100 tap, out of which 100, how much is positive? That's called as the rate of positivity, right? So what are the risk factors basically? So who are at more risk of developing this kind of diseases? One is cigarette smoking, chronic lung disease, advanced age, prior hospitalization, with discharge within 10 days before onset of pneumonic symptoms, and of course immunosuppression, maybe a transplantation, HIV, glucocorticoids, and tumor necrosis, factors alpha deficiency as well. So remember, to start with, we started as Pontiac fever, right? So that Pontiac fever can occur in epidemics, but usually self-limiting, and the attack rate is more than 90%. So whenever the attack rate is very, very high, it tells you that it's airborne, right? It's very, very high, it's going to be airborne. So recently we had this COVID as well, right? So airborne. So pathogenesis and immunity, Legionella enters the lungs through aspiration or through direct inhalation as well. So once it's inside the lungs, attachment to the host cells is mediated by the bacterial type 4 pili, heat shock proteins, and the major outer membrane protein. Okay. So Legionella binds to the complement CR1 and CR3 integrin receptors on the cell surface. So remember, it is the pili which is more important, right? So if at all your cough mechanism is diminished in your patient, right? If all the respiratory tract epithelial cells, the mucociliary clearance is diminished in your patient, if the patient is not able to bring out the sputum, those are the patients who are at high risk of developing this kind of disease. Okay. So because the organisms possesses pili that may mediate adherence to the respiratory tract epithelial cells, conditions that impart the mucociliary clearance, including cigarette smoking, lung disease, or alcoholism, predispose the patient to Legionnaires disease. So cell-mediated immunity is a primary mechanism of host defense against Legionella. Okay, like any other intracellular pathogen. Whenever there's an intracellular pathogen, the cell-mediated immunity comes there, kills that particular infected cells, right? So thus, Legionella disease is more common and its manifestation is more severe among patients with cell-mediated immunity deficiency. Okay, so any intracellular pathogen is usually killed by your cell-mediated immunity. So if your patient is having a deficiency of cell-mediated immunity or T-cell deficiency, then they are more prone for intracellular pathogen-related diseases, and one among them is Legionella disease. Okay, so disease also occurs in unusual frequency among patients with hairy cell leukemia, which is characteristic of monocyte deficiency as well. Okay, so now the organism is inside the lung and it is attached to the pili and it has reached the macrophage, right? So inside the macrophage, the alveolar macrophages readily phagocyte this kind of Legionella. Okay, attachment of the bacteria to the phagocyte is mediated via the FC receptors, complement receptors, which attach to the bacterial major outer membrane protein. Binding to receptors promotes the phagocytosis, but then it fails to trigger an oxidative burst. Okay, so first mechanism that is preventing the human beings from getting infected from Legionella is your mucociliary clearance. Because of the risk factors like cigarette smoking, COPD, alcoholism, this kind of first line of defense is broken. The second line of defense is usually neutrophils, which is not having much role in Legionella. Because in vitro studies shows Legionella can actually perform better in oxidative burst as well. So the first line of defense, mucociliary mechanism, is lost. Second line of defense, neutrophils, does not have much role in Legionella. Third is the macrophages. So macrophages can engulf the Legionella, but it fails to trigger oxidative burst. So even the third line of defense is actually weak. So Legionella pneumophilia phagosome resists acidification, evades fusion with killing lysosomes, right? So many Legionella are killed, some proliferate intracellularly until cell ruptures. The bacteria are then phagocytes again by a new phagocytes, and this again cycle keeps continuing. So the role of neutrophils, which is usually the first line of defense, right? The role of neutrophils in immunity appears to be minimal, because specifically to say even neutropenic patients are not predisposed to Legionnaires disease. Because although this kind of pneumophilia is susceptible to oxygen-dependent microbiological systems in vitro, it resists killing by neutrophils. So the first line of defense is going to be your mucociliary mechanism. Second line of defense is neutrophils, which is not going to work in Legionella. Third is your macrophages, which is able to phagocyte, but it fails to create oxidative burst. Next comes your humoral immunity. That is IgG and IgM antibodies, right? The humoral immune system is active against Legionella. In Listeria, it has no role. In Legionella, it has a major role. Type-specific IgM, IgG antibodies occur within weeks of infection. Okay. In vitro antibodies promote killing of Legionella by phagocytes, neutrophils, monocytes, alveolar macrophages in vitro. Okay, not in vivo. Immunized animals develop a specific antibody response with subsequent resistance to Legionella challenge as well. So such good response is from the humoral immunity. However, these antibodies neither enhance the lysis by complement nor inhibit the intracellular multiplication within the phagocytes. So it is not going to kill that particular cell. Okay. Some of these pneumophilia strains are clearly more virulent than others. Okay. Why we are specifically mentioning this is, since you have identified a pneumophilia doesn't mean that the patient has the disease. And since you have identified a pneumophilia doesn't mean that every patient will respond the same way. Okay, because there are various strains, there are various serotypes. One can be very virulent and one can be very soft also. Okay, so but we don't know what is the precise virulence factor in these strains. For example, although multiple strains may colonize water distributing system, only a few cause disease in patients exposed to these kind of waters. Okay, so since there is pneumophilia, if it's not a virulent strain, it's not going to cause much of an infection in your patient. Okay, so at least one surface epitope of Legionella pneumophilia serogroup 1 is associated with virulence. So till now we have documented 1 or 2 virulent factors only. Similarly, Legionella pneumophilia serogroup 6 is more commonly involved in hospital-acquired Legionnaires disease, and is more likely to be associated with poor outcome as well. Okay, basically virulent factor. So now we know that initially it was thought that there's a reservoir or the cooling towers which is the actual source of the Legionella. Later it was proved it's a potable water, right? And the mode of transmission is more likely an aspiration either from the oropharyngeal area or from the drinking of the water and regurgitation, which is more common associated with head and neck surgeries, basically surgeries with general anesthesia, intubated patients, and the patients who are on Ryle stream, all these things, right? So, and you know how to identify these things. And now the clinical presentation could be Pontiac disease, which is acute self-limiting flu-like illness, and the incubation period is only 1 to 2 days. Pneumonia does not develop in a Pontiac fever. It's a self-limiting fever. Okay. Otherwise, malaise, fatigue, myalgias are most common symptoms. That's 97%. Fever with chills, headache develops in around 90% of cases. Okay. Other symptoms like arthralgias, nausea, cough, abdominal pain, diarrhea, and other constitutional symptoms do occur in less than 50% of cases. Further course of Pontiac fever is that you will find modest WBC increase, leukocytosis, with a neutrophilic predominance in sometimes. Okay. Without antibiotic therapy itself, complete recovery should take place in few days. Okay. Some people will feel laziness, weakness, tiredness for many weeks thereafter. Okay. And diagnosis established by the antibody seroconversion. So Pontiac fever is not actually a concern. What is more concerning is your Legionnaires disease, the pneumonia, right? Legionnaires disease is often included in the differential diagnosis of atypical pneumonia, along with infections due to the Chlamydia pneumophilia, Chlamydia psittacea, Mycoplasma pneumoniae, Coxiella burkitti, and other some viruses as well. The clinical similarity about this kind of atypical pneumonia is that they usually have non-productive cough, and it is low incidence of any gross purulent at all. Okay, so there will be significant pneumonia, but less of productivity, less of productive cough, less of sputum production, but severe pneumonia. So this is usually atypical pneumonia. Okay, so but Legionnaires disease are usually more severe than other causes of atypical pneumonias. Okay, and if you see how the progress is, atypical pneumonias usually go very slowly, not like a pneumococcal disease. But Legionnaires disease is one atypical pneumonia which progresses as equal to as if the patient got a pneumococcal disease. Okay, so atypical pneumonia is usually non-productive with less of sputum production, and they actually are very subacute, except Legionnaires disease, which is very severe in presentation, and the severity almost equals like as if you are treating a pneumococcal disease. And it is our observation that patients with community-acquired Legionnaires disease in specific, a patient coming with your CAP, community-acquired pneumonia, if it's because of Legionnaires disease, they end up in ICU on presentation itself. Okay, so usually they'll come with fever, cough, they end up with OPD, they get tablets, medications, they go home, they come back, they get admitted in ward. That's how the usual pneumonia pattern is, right? But Legionnaires is so severe that on presentation itself, you'll be seeing much of the variables which is not online, which is not up to the mark, and the patient will end up with ICU on presentation itself. The incubation period of Legionnaires disease is 2 to 10 days. The symptoms and signs range from just a mild fever and cough to widespread pulmonary infiltrates and multisystem failure also. Of course, you do have some non-specific symptoms like malaise, fatigue, anorexia, headache in the early part of it. But this kind of myalgia, arthralgia is uncommon. And even the upper respiratory symptoms are uncommon. It directly affects the lung, right? So mild cough of Legionnaires disease is only slightly productive, and that particular very little amount what is produced can be with a streak of blood.